Hello, I'm Dr. Kalpana Mehan, ENT consultant and allergy specialist. So today we'll be talking about allergies on whole and particularly nose allergies. So allergies, we all must have heard about that word. Allergy is hypersensitivity reaction to a particular thing. When a person is exposed to something and he gets a reaction. So that's something in medical terms we call it as allergen. So allergen, it could be anything, like it could be an aeroallergen in the form of pollens or house dust, or it could be a food allergen, like some people may be allergic to banana or food milk products, and otherwise allergen could be an insect or something drugs also, they can also cause allergies. So the symptoms of allergy, when do we say that person is allergic? Allergy can present in various with various symptoms, like in particularly skin allergies, like patient will present with skin itching and redness over the skin, all over skin. And then eye symptoms are in the form of watering in the eyes or redness in the eyes. And nose symptoms, they are like excessive sneezing, watery nasal discharge and nasal congestion. And later on it can progress to respiratory allergies, which we call it as bronchial asthma. In our medical literature, it is known that 80 to 90% of the patients who are having nasal allergy in the form of excessive sneezing or watery nasal discharge, they may progress to bronchial asthma in future in the form of it may be mild, moderate or even severe kind of asthma. Once we have diagnosed that person is having allergy, we should further make a point that person is allergic to which allergen. That is very important. So for that purpose we need to do certain tests. The gold standard test to go ahead is skin prick test. It's a very simple test, but it's a gold standard test. In this we take a small amount of a drop of allergen and we put it on the skin, and then we prick the skin using a very small lancet or maybe a needle, and the reaction is noted. Reaction is interpreted in the form of either redness or like raising of that area particularly, and then it is measured and we get to know the patient is allergic to which allergen. So doing skin prick test, it has three advantages in whole. Firstly, we'll diagnose that yes, this person is having allergy. Secondly, to which allergen he is allergic. And thirdly, we can treat that patient in the form of immunotherapy, which is basically allergy vaccine. Once the person is diagnosed as having allergy and particular to this allergen, then we go ahead. So number one treatment strategy in these cases is avoidance of that allergen. Like if something we can avoid, we are allergic to something, for example, say cat dander or dog dander, so one person can avoid that pet, or either somebody can have a food allergy from banana or milk, whatever, so he can avoid that. But certain things we can't avoid it. For those purposes we go ahead with medications. Number one, like temporarily we can treat allergies using oral medications like oral drugs, or either nasal sprays, or sometimes like inhalers for bronchial asthma. But these are just for temporary cure. The permanent cure is possible. Now it's possible, it is with immunotherapy. Immunotherapy, it's just like in layman terms we call it allergy vaccine. Like we give vaccine to children and we make the patient or the child sensitized to that infective agent. In this also we are doing the same thing. We are giving in a particular concentration amount of allergen and we are giving it at a repeated time, and we make the patient hypersensitized to that particular agent. To conclude this talk, I would like to highlight 2 points. Number one is allergy is curable. Now with recent advances, as we are doing skin prick test and we are diagnosing the allergen, and then we are going ahead with the allergy vaccine in the form of immunotherapy. Secondly, as I have already said, that all the patients who are having nose allergies in the form of excessive sneezing and watery nasal discharge, they may develop bronchial asthma. So we have to break that chain so that they should not progress further into bronchial asthma. We have to break that chain. For that, immunotherapy is the answer. So I hope this talk is informative to you. Thank you.